Welcome to episode 17 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're diving into the fascinating world of neurotransmitters. These chemical messengers play a central role in communication within the nervous system, influencing everything from muscle movement to mood. In our next episode, we'll spend a lot of time talking about the autonomic nervous system, but with this one, we're focusing on neurotransmitters and their receptors. Now, neurotransmitters are chemicals released by neurons to transmit signals to other neurons, muscle cells, or glands. And we talked about them a little bit during our chemical synapse episode. They're classified based on their chemical structure or the type of receptor they activate. Some key features of neurotransmitters include the fact that they're released in response to an action potential, they bind to specific receptors on postsynaptic cells, and their effects can be excitatory, which promote action potentials, or inhibitory, which prevent action potentials. Neurotransmitter receptors can be categorized based on the neurotransmitter they bind to or the agonists that activate them. Two major categories of receptors are cholinergic receptors. These receptors bind acetylcholine and are subdivided into two types: nicotinic cholinergic receptors, and these are ionotropic receptors, or receptors that directly open ion channels, leading to a rapid response. Nicotinic cholinergic receptors are found at the neuromuscular junction and in the autonomic nervous system. Examples of nicotinic cholinergic receptors, nicotine acts as an agonist mimicking acetylcholine, and so this is why they're called nicotinic cholinergic receptors. Remember, anything that's called a cholinergic receptor can be activated by acetylcholine. Nicotinic cholinergic receptors can be activated by both acetylcholine and nicotine. Then we have muscarinic cholinergic receptors, and these are metabotropic receptors that activate G proteins, leading to slower but longer-lasting effects. Muscarinic cholinergic receptors are found in the parasympathetic nervous system and various tissues, including the heart and some glands. Muscarine, which is a toxin from certain mushrooms, acts as an agonist. So in this case, for a muscarinic cholinergic receptor, it can be activated by either acetylcholine or muscarine. Okay. Nicotine will not activate a muscarinic cholinergic receptor, nor will muscarine activate a nicotinic cholinergic receptor. We also have adrenergic receptors. Adrenergic receptors bind norepinephrine and epinephrine and are divided into two main classes. And I want to be clear here that acetylcholine has no effect on adrenergic receptors, just like norepinephrine and epinephrine have no effect on cholinergic receptors. The two main types of adrenergic receptors are alpha receptors and beta receptors. We can subdivide alpha receptors further into alpha 1 and alpha 2. Alpha 1 receptors are found in vascular smooth muscle, and when they're activated, they cause vasoconstriction. Alpha 2 receptors, on the other hand, are found in the brain, and when they are activated, they inhibit the release of neurotransmitter. As I mentioned a moment ago, we've got beta receptors, and there are three different types of beta receptors. Beta 1 receptors are found in the heart and kidneys, and when they're activated, they increase heart rate and/or force of contraction. Beta 2 receptors are found in the lungs and on smooth muscle, and so when they're activated on the lungs, they cause bronchodilation and relaxation of smooth muscle. Finally, we have beta 3 receptors. These are found in adipose tissue, and when they're activated, lipolysis is promoted, and lipolysis is the breakdown of fat. Now, we can also look at cholinergic and adrenergic receptors and compare and contrast them. Cholinergic receptors bind acetylcholine. Adrenergic receptors, on the other hand, bind norepinephrine and epinephrine. Cholinergic receptors include nicotinic and muscarinic subtypes, whereas adrenergic receptors include the subtypes of alpha and beta. Cholinergic effects are typically associated with parasympathetic activity, or rest and digest, whereas adrenergic receptors are typically associated with sympathetic activity, or fight or flight. Now, adrenergic receptors often work through G proteins, which amplify and regulate the signals. These main pathways include G-alpha-S, which are associated with beta 1 and beta 2 receptors. Ultimately, these pathways activate adenylate cyclase, which increases CAMP levels, ultimately activating protein kinase A. The G-alpha I, or inhibitory pathway, is associated with alpha-2 receptors. This inhibits adenylate cyclase, which reduces CAMP levels as well as the activity of protein kinase A. Finally, we have G-alpha-Q. These are associated with alpha-1 receptors, and they activate phospholipase C, which ultimately lead to the production of DAG and IP3. This IP3 activates protein kinase C release and causes the release of calcium ions. DAG causes the activation of PKC, IP3 causes the release of calcium ions. So we need to understand neurotransmitters, or understanding neurotransmitters and the receptors is critical for medicine and pharmacology. For example, beta blockers are drugs that block beta-1 receptors, beta blockers, or drugs that block beta-1 receptors, are used to treat high blood pressure by slowing heart rate and reducing cardiac output. Some asthma medications are beta-2 agonists like albuterol, and ultimately they relax bronchial smooth muscle, making it easier for a person to breathe. Then you've also got cholinesterase inhibitors. These drugs increase acetylcholine levels. Acetylcholinesterase is an enzyme that breaks down acetylcholine. So if we inhibit this, acetylcholines will go up, and this can be helpful in conditions like someone that has Alzheimer's disease. So let's wrap up with our key takeaways. Neurotransmitters are chemical messengers that bind to specific receptors to transmit signals. Cholinergic receptors bind acetylcholine and include nicotinic, which are ionotropic, and muscarinic, which are metabotropic types. Adrenergic receptors bind norepinephrine and epinephrine and include alpha and beta subtypes, and each of them has distinct locations and effects. G protein pathways amplify and regulate signals through second messengers like CAMP and calcium. And so with that, we are finished with episode 17 of the Pulse of Physiology. I hope this exploration of neurotransmitters has deepened your understanding of their roles in the nervous system. Please join me next time for episode 18, where I'll discuss the autonomic nervous system and its critical functions. Until then, keep questioning, keep exploring, and stay curious.